Well, interestingly, with breast implants, one thing I do stress to patients is the commitment that they're taking on, because simply put, implants are not for life, and implants do need to be changed at some point in the future. So one needs to be aware of that and understand that, particularly if they're quite young as well, which means if they want to keep their breast implants, it means they're going to have to sort of change them every 10 to 15 years. Now, we give that as a rough time for everybody because it's impossible to predict precisely how long each implant lasts in each individual. A lot of that does depend on the person's individual activities, the normal wear and tear. We all sort of use our bodies in a different way, and therefore the implants are subjected to different strains and stresses over the years. So I usually tell patients at around sort of 7, 8 years after they've had their operation, they should really get an ultrasound scan, which would effectively check the integrity of the implant and tell us what it's doing. That way we can then tell the patient, it's fine, carry on, maybe do another check ultrasound scan in a couple of years' time or so. But if at some point that ultrasound comes back and suggests that the implant has worn down, which basically means the actual outer shell of the implant wears down, then that needs to be changed. Now, of course, that's not the only reason we would change implants, because let's face it, our bodies change as we get older. Sometimes we go through pregnancies, women go through pregnancies. So as the body changes, the breast can change, particularly if they've breastfed for a number of months afterwards. So there are situations where women decide they would like to change their implants and perhaps even change their breasts if they feel they've been subjected to the stresses of pregnancy. For example, they feel they've sagged or drooped. So in those situations, we might need to do a tidy up to actually lift the breast and tighten up the skin around the breast. At the same time, some women change their mind about the size of their implants as well. There's no point having a mind if you can't change it. And some people just feel, they feel, that was okay for that period of their life, but now they feel they want to go bigger, or perhaps they want to go smaller. So these are things that we discuss with patients, providing, they give us clues as to what they want to achieve. Now, of course, the other thing that does rarely arise is you have women who come to me who say they've had their implants for X number of years, and now suddenly they feel they don't want them. Now, in those situations, obviously we have a discussion with the patient to try to, for me to understand what it is they're not happy about. And for some patients, now I just want to stress that it's actually quite a low number of patients who actually come requesting have the implants removed altogether. But for some patients, they come to me and they say, simply put, I just don't feel, they're part of me anymore, and I just don't want them there. They have their own reasons. Now, in those situations, I will discuss with the patient what the implications of that decision are. The implications are that you have to understand you will lose that volume effect that the implant is affording you. Okay, it's giving you a little bit of more fullness, and particularly in the upper part of the breast, so they will lose that. So the breast will feel somewhat deflated, and that's something they need to understand. The other thing, of course, that I stress to them is a lot of it, how deflated it will look, will depend on how long the implant's been there. Because obviously after many years of being subject to certain volume of the implant, the skin lifts up, and when you remove that volume, it tends to deflate. And as we get older, our skin also thins out as well. So they may get a little bit of crepiness or wrinkles or folds in the skin. So that's something they need to understand is a definite possibility once they've had them removed. Now, for some women, particularly if they've had small implants, that may not be an issue, because obviously the volume effect of the small implant is much less than, say, a large implant, which exerts more influence on the actual skin of the breast. So these are things that we discuss with patients, and providing they all understand what the implications of those decisions are, then yes, you can, I can advise that they can have the implant removed. Technically, it's not a difficult procedure. What we do is we effectively remove the implant, remove any sort of scar tissue or capsule that the implant has created, and we usually sort of close off the pocket inside internally to avoid any fluid buildup. So technically, it's a day case procedure. It doesn't take a long time to do, so patients recover quickly from it. But they need to understand that they'll need need to come to terms with the implications of losing that volume effect. The other thing, of course, I do mention to them is that there is a transition period for about 3 to 6 months' time where the breasts perhaps feel a little bit looser than they will be ultimately, because with time you find that even after you remove the implants, the skin does kind of shrink back to a certain degree. But again, that's something that's very hard to predict, and that's not something that I can tell patients accurately what will happen in that instance. So these are discussions that we take on board together with the patient and collectively make a decision according to what the patient feels they want and what their needs are.